What is pneumonia? A pneumonia is an inflammation or infection of the alveoli. Occurs at a rate of 2 to 4 children out of 100. It may be of bacterial origin, so these are pneumococcal, streptococcal, staphylococcal, or chlamydial, or viral in origin, which is the RSV or the respiratory syncytial virus. So it is a respiratory virus that infect the lungs and the breathing passages. So we had two types of pneumonia. First is the hospital-acquired pneumonia. So these are the pneumococcal or streptococcal pneumonia. The next is the community-acquired pneumonia, which is the chlamydia and the viral pneumonia. First, we have pneumococcal pneumonia. The onset of pneumococcal pneumonia is generally abrupt and follows an upper respiratory tract infection. The causative agent for this is the Streptococcus pneumoniae or the pneumococcus. About the risk factor, these are children less than 2 years old and elderly person ages 65 years old and above. Next is condition that weakens the immune system, chronic disease such as heart, lungs, liver or kidney disease, asthma, and diabetes, and also cigarette smoking and asplenia. Next is the signs and symptoms. So children having this pneumococcal pneumonia manifest high fever. The fever of this disease may rise as high as a child that has febrile seizure. Next is nasal flaring, retraction, chest pain, chills, dyspnea, tachycardia, and tachypnea. So because the lung space is filled with exudate, the breath sound will be diminished because air is no longer or poorly enters the alveoli. Then we may hear crackles or rales as a result of the fluid. Then laboratory studies will indicate leukocytosis. Next, we have chlamydial pneumonia. It is most often seen in newborn up to 12 weeks of age because of the chlamydial organism is contracted from the mother's vagina during birth. So the causative agent for this is the chlamydia pneumoniae or the C. pneumoniae. The risk factors are gender, smoking, lowered HDL cholesterol, and hypertension. About the signs and symptoms, so it begins with nasal congestion and sharp cough. For infant, it may fail to gain back their birth weight, so the symptoms progress to tachypnea with wheezing and rales audible on auscultation. Upon laboratory assessment, it will show an elevated level of immunoglobulin G and M antibodies, peripheral eosinophilia, and specific antibody to Chlamydia trachomatis. So the third one is the viral pneumonia. The etiology, viruses of the upper respiratory tract infection. So these are RSVs, myxoviruses, and adenoviruses. So myxoviruses is one group of RNA-containing virus including the influenza. And the adenovirus causes variety of illness and of cold-like symptoms, fever, and etc. This type of pneumonia is airborne and contagious. So 2 years old, younger, and 65 years old and above people are at risk. And also people that works or live in a hospital settings and suppressed immune system. So if you have a weak immune system, you are at risk to different diseases and chronic illness such as asthma and other respiratory infection, cancer, smoking, and recent viral infection. The signs and symptoms, again, it begins as an upper respiratory tract infection, and after a day or two, you may experience low-grade fever, non-productive cough, tachypnea, also diminished breath sounds and rales upon auscultation. RSV may cause also apnea and fatigue. Mycoplasmal pneumonia. The etiology or the causative agent is the Mycoplasma pneumoniae or the M. pneumoniae. So this is a short rod lacking a cell wall which belong to a class of molluscs. The risk factor, children ages 5 years old and above, and climate is also a risk factor, especially in late summer and fall. About the signs and symptoms, it may manifest fever, cough, and large cervical lymph nodes and persistent rhinitis. Lipid pneumonia. It is a rare disorder due to the accumulation of fatty oily material in the alveoli and usually associated with underlying conditions such as gastroesophageal reflux, swallowing disorder, and etc. The etiology is the aspiration of an oily or lipidic substances such as peanut or popcorn. The risk factor is again aspiration of oily or lipidic substances such as peanut or popcorn and mineral oil. There are two types of lipid pneumonia. First is the exogenous lipid pneumonia. So from the word itself, exogenous. So it occurs when the fat particles enters from the outside of the body to the lungs via nose or mouth. Then the endogenous lipid pneumonia. Fat particles accumulate in the lungs, causing inflammation. About the signs and symptoms, so the initial coughing at the time of aspiration, then followed by a symptomless period. Then next is the chronic cough, dyspnea. A chest X-ray shows densities at the affected site. Hydrocarbon pneumonia. The etiology are common household products such as furniture polish, keyboard cleaner, turpentine, kerosene, gasoline, and etc. that have the component of hydrocarbon bases. The risk factors are the ingestion of hydrocarbon-based product and children younger than 5 years old and adolescents. About the signs and symptoms, so if the child swallow a hydrocarbon-based product, they may experience gastrointestinal symptoms like nausea and vomiting. Next is coughing. It is from the inhalation of this content as vapor from the stomach rise and are inhaled. Next is the bronchial edema. It is from the irritation and inflammation of this content, and shallow respiration may manifest increase in rate and dyspneic. Upon physical assessment, it may manifest an increased percussion sound caused by air trapped in the alveoli, and wails may also be heard caused by the air passes through the collecting mucus.
For the pneumonia, the first one we have is the pneumococcal pneumonia. So for the nursing management, first we need to reposition the child frequently to avoid the pooling of secretions. Next will be the encouragement of the parents to ask more about their child's condition, to understand why the therapies that needs to be done for their child is necessary, and the counseling of the parents about the degree of fatigue that the child may experience during the febrile stage of their condition. Next would be to assess the oxygen saturation levels of the child through the pulse oximeter. For the medical or laboratory management and medications, we have intravenous therapy, administration of the humidified oxygen and the chest physiotherapy, and the administration of amoxicillin and antibiotics such as ampicillin and the third generation of cephalosporins, which are both effective in going against the pneumococcal pneumonia, and the administration as well as the amoxicillin clavulanate or augmentin as prescribed by the physician. Next, we have the chlamydial pneumonia. So for the nursing management, we need to assess and observe for any signs of tachypnea or wheezing and rales. For the medical or laboratory interventions or medications, we have to do laboratory assessments in order to observe for the child's elevation in the levels of the immunoglobulin G and immunoglobulin M antibodies, and for the elevation of peripheral eosinophilia and the specific antibodies of C. tomacomatis. And then next we have the administration of macrolide antibiotic, such as erythromycin. For the viral pneumonia, the nursing intervention would be to facilitate and ensure that the child is having quality rest. Next would be the counseling of the parents about the degree of the fatigue that the child may experience, and the differences of the viral and bacterial infections for children. Then for the laboratory or the medical interventions for viral pneumonia would be to perform chest x-rays and the administration of antipyretics and intravenous fluids. In terms of mycoplasmal pneumonia, the nursing intervention would be to observe and assess for the enlargement of the child's cervical lymph nodes, and for the intervention when it comes to the laboratory and the medical intervention would be the administration of erythromycin or tetracycline as prescribed by the physician. For the lipid pneumonia, we have to first observe the child's coughing, and then observe for chronic cough, dyspnea, and general respiratory distresses. And for the laboratory or medical intervention, we would need to do the chest x-ray of the client, and then as well as the administration of the antibiotic therapy and bronchoscopy or surgical resectioning of the lung portion if needed. Then for the next type of pneumonia, we have hydrocarbon pneumonia. So for the nursing intervention, we have to first observe the vital signs of the client, which is the most important part of this would be the respiration. Next would be to observe the child's general appearance, and then frequently change positions of the child, and then explain the awareness or unaware extreme dangers that the different everyday household products can do to children. And for the dependent, we need to obtain evidences of respiratory tract obstructions and signs of drowsiness, as well as symptoms of CNS involvement and intoxications. For the laboratory or medication interventions, we have the administrations of emetics, and then the application of nasogastric lavage, and chest physiotherapy, administration of antipyretic when it comes to the febrile stage of the client, and also the administration of cold, moist air through a nebulizer. So the nursing diagnosis is the ineffective airway clearance related to collection of secretions affecting oxygen exchange across alveolar membranes. So when it comes to complications of pneumonia, so for children, there's a risk for the development of emphysema, tension pneumothorax, AOM, pleural effusion, and then parapneumonic effusions, lung abscess, pneumothorax, pneumotocele, delayed resolution, respiratory failure, metastatic septic lesions, and the activation of latent TB.